So in this article, we show that an endocytosis and trans-tissue transport pathway we discovered a few years ago is a novel endocytosis pathway. It is different from all the known pathways, which we compared it with by using siRNA screens and chemical inhibitors and so on. Now, so this system is also, and I think this is the most interesting part of what we discovered, this system is nutrient regulated. If a tissue is low in nutrients, it turns up this system, the activity of this system, and vice versa if there are sufficient nutrients. So we can regulate it with by taking away the nutrients from cells or tissues, or we can also regulate it through mTOR, which is a major regulator or sensor of the nutrient status of cells. If we suppress mTOR activity, the activity of this system, which we have named the see-and rule system or sender system, goes up, and if we mimic a situation where the tissues have sufficient nutrients, for example with insulin, then the activity of the system is suppressed. Now, the physiological function of this system is probably to help cells survive when they have insufficient nutrients. And as is always the case, tumors have taken over this system to utilize it for their own purposes, for the purposes of their growth and survival. We have compounds that allow us to activate this system specifically in tumors, not elsewhere. And these are small peptides that bind to the neuropilin-1 receptor. When a peptide binds to neuropilin-1, it activates this trans-tissue transport pathway. And as I said, we can do it specifically in tumors. Now, what this allows us to do is to activate the system in a tumor and then give a drug at the same time. And what happens is that more of the drug goes into the tumor, but not elsewhere. And the result is greater efficacy, or we can also lower the amount of drug and still get the same effect as without our compound, and get the same effect and reduce side effects. Or we can do some of both. We think that this system has a future in drug delivery, particularly because of one aspect that I haven't mentioned so far, and that is that tumors, as you probably all know, have ways of preventing drugs from getting into them. And our transport pathway bypasses these barriers, and that way we can get even into the tumor cells that are far from blood vessels and otherwise might not get any drug. So we think that this system has a future in drug delivery.